It is mostly during emergencies that the glaring deficiencies in Kenya's healthcare sector are exposed, whether it is in the access to health service or availability of medical commodities. On Health Digest this week, our health correspondent Dr. Korir visited the regions surrounding the Lake Victoria and now tells us what the situation is like there.
At Lake Victoria's Usenge Beach, it is business as usual, sorting out various catch. These residents have options for health services compared to their counterparts living in the various islands in the lake.
It's either you wait for the ferry or hire a boat. Maybe a boat that is supposed to take 6 people. You're like 15 people in that boat.
These are the boats and a water ambulance docked at Mageta Island.
The purpose of that ambulance was for ferrying people from Mageta, those sick people, and any emergencies. It's supposed to operate within almost 4 islands. Many emergencies coming with this transport ferry. And transport ferry, it has some time limit.
It leaves here early in the morning, that is at 8 o'clock, strictly. Then it gets back to this place at 10:30, leaves at 11:30. Comes back again at 3:30.
In the event of an emergency outside those timings, especially maternity-related, hiring a boat may take more than 2 hours.
It's unfortunate for the women living on the other side.
Accessing their workstations is also challenging for the health workers.
When it's raining, you find that this place is flooded. You have to take off your shoes to get to the ferry, and at times the water is dirty, it's muddy.
These boats carry everyone and everything. We are making this journey to Mageta Island on a commercial boat that cost 100 shillings per trip. This journey is one made by many mothers with no alternative in search of health services.
You can see it's overloaded and there are no life jackets in the boats.
So where do you put a mother if they're in a critical condition and the boat is like this?
You have to carry blankets and spread on the small wooden seats. One instance I remember, it started raining in the lake and there were waves and currents and it was scary.
That is exactly what befell us as we took a boat to Remba Island. 3 hours of this journey felt like an eternity. Remba is one of the most difficult to access islands due to the rough waters. On a regular boat, residents take at least 6 hours in the lake.
Kama patrol boat yetu imeenda kwa kazi ingine, inabidi huyo mtu aangamie. Ya pili, medical supply sio nzuri. Saa zingine unaweza kosa madawa kwa hii unit yenye iko hapa.
Remba Island has an estimated population of 10,000 people. It has only 1 health unit and 2 nurses with no doctors, no clinical officers. In case of an emergency, the residents here are faced with limited options, and there's only one way out of this island, and it's through the turbulent lake.
The nearest is Sindo, where you can take around 30 minutes kufika. Alafu inafuatwa na Mbita, which is around 1.5 hour to 2.
This is when the lake is calm.
Tungeomba wale wahusika watuletee huduma ambazo zinaweza kutufaa hapa Remba.
The component of accessibility of health services is one that needs a critical approach if the dream of universal health coverage is to be realized. Dr. Korir for Health Digest, KTN News.